Sometimes I feel like throwing my hands up in the air. I know I can count on you, oh baby.
Sometimes I feel like saying, Lord, I just don't care. But you got the love I need to see me through.
AIDS seems to be falling off the public's radar. The sense of urgency and anger that led to life-saving medical breakthroughs, well, it's kind of evaporating. In 1995, 44% of Americans named HIV/AIDS the nation's most urgent health problem. In 2009, just 6% did. And yet more than 56,000 Americans are newly infected with HIV every year.
I love this work. It can sometimes be very difficult because we are truly the David of non-profits, fighting the Goliath of diseases.
The year 2012 will mark the 20th year since the establishment of the Elton John AIDS Foundation in 1992. Since that time, the Foundation's annual grant-making has grown to a record $7.1 million in 2010, encompassing grassroots and community-based programs, regional partnerships, national strategies and policies, and international cooperative efforts. Combined with the efforts of its sister organization in the UK, the Elton John AIDS Foundation has raised over $225 million in support of worthy programs in 55 countries over the past 20 years. The Foundation's work is more critical than ever. Today we are witnessing important breakthroughs in HIV/AIDS prevention, treatment, and outreach. This is an exciting time, but it's also a time of cutbacks and budget deficits that are threatening to worsen the epidemic, just as science is giving us more hope of ending it.
It's an epidemic that's sweeping through this country. The rhetoric that comes from people's mouths, whether it's religious intolerance, racial intolerance, or homophobia, I've been coming here for 40 years and I love this country deeply, but I'm so shocked at the state of which we've become, which this country has become at the moment.
Now more than ever, the leadership of the Elton John AIDS Foundation is urgently needed. This year, many states are considering or have already implemented cutbacks in programs that help low-income Americans living with HIV.
Every dollar we spend on treatment and prevention must be raised from private donors, which is a tall order, especially in today's economy.
The state of Florida, which has the largest AIDS drug assistance program waiting list in the country, is considering policy changes that would eliminate thousands more from their existing program in order to cut costs. When the Florida State Department of Health released its proposal to cut thousands of poor Floridians for the state's AIDS drug assistance program, Elton and I immediately sent a letter to Florida Governor Rick Scott, urging him to strike down this harmful, inhumane, and fiscally ineffective program. Today, nearly 9,000 HIV-positive people who can't afford health insurance are on a waiting list to receive discounted antiretroviral medications.
Now in the state of Florida, we have a waiting list to get people access to medication. So while the work we do around bringing people into care really is stellar, and the funding of the Elton John AIDS Foundation helps support that, as we said, we now hit this wall where, okay, you're positive, you need to be on medications, and you're gonna have to wait.
The list that keeps growing, those of us who are on the ADAP waiting list, I'm very concerned. Funding needs to be provided for us to be able to get the medication that we need.
It is a little overwhelming, the fact that we can't get help through to the state. Do I worry? Yeah. I've worked in banking and in the mortgage industry, and that doesn't exist anymore. So I mean, I would be kind of lost without their resources.
We champion the underdog because the underdog must never get left behind. Every person deserves our help. Every person has dignity, no matter what position they're in.
U.S. Senator from the state of Florida, Bill Nelson, was an important partner in this effort.
With the time of such promise of the advance of these drugs to save people's lives, this is when we need to constantly remind the decision makers that now's not the time to cut back. We are our brother's keeper. Now that ought to be just second nature to us of providing for our own people in our own country.
And if you let people think they're not cared about and forgotten, then that's the worst thing you can do to any individual.
This past year, in one of the most important developments since the advent of antiretroviral treatment, the National Institutes of Health announced new research showing that HIV/AIDS treatment also helps to prevent further spread of the disease. In fact, HIV-positive people receiving effective treatment are 96% less likely to pass the disease on to their uninfected partners. Put simply, treatment is prevention. Unfortunately, while breakthroughs are being made in scientific research, breakdowns are occurring in response to the AIDS crisis.
Wake up, America. Wake up. It's your young people that are your future. If you deny your young people the knowledge about this disease, then things aren't going to get better.
This growing gap is being addressed by the Elton John AIDS Foundation, which funds innovative programs such as the Bailey House Post-Prison Community Reentry Program in Harlem.
Our mission has grown really with the epidemic, and today we know that housing is prevention, housing provides access to care, so our mission is to provide all the kinds of services that people need to stay stable and in treatment.
I'm 53 years old. I've been in and out of prison for the last 22 years. Going on 2 years that I've been infected with HIV.
You know, you give people some support and a support network, and it's amazing how they can manage their illness and how they can make a life.
To get this kind of service, this quality of services, it's a beautiful thing.
And you have to care about all sections of society. You have to teach them about this disease, and especially people in prison who are marginalized.
I haven't felt this good in a while.
This year, in addition to advances in treatment, advances in corporate social responsibility have given us hope of new energy and momentum in the fight against AIDS. Ebony, a publication of Johnson Publishing Company, has partnered with Greater Than AIDS and Walgreens to produce a special Be Greater Than AIDS information guide.
I've been incredibly proud of the partnership that Ebony magazine has with Greater Than AIDS. HIV and AIDS disproportionately affects the African American community. Of the 1.1 million people in this country living with HIV and AIDS, over 50% are African American.
The AIDS epidemic in Black community, it continues to be out of control. You know, our house is on fire, and we need to figure out how to put that fire out.
We feel that it's incredibly important as a company, as a magazine that talks to the African American community on a daily basis to address this issue personally.
In another example of corporate leadership, Walgreens, the nation's largest drugstore and pharmacy chain, has teamed up with the Elton John AIDS Foundation and the Kaiser Family Foundation's Greater Than AIDS campaign to create HIV Centers for Excellence at more than 450 Walgreens stores across the country.
We have supported, the patients suffering from HIV/AIDS for years in our neighborhoods, in our communities.
These stores now provide rapid oral HIV testing, one-on-one medication counseling, and confidential care.
I'm very proud to be a Walgreens pharmacist because of this collaboration, because Walgreens has taken on this responsibility, one that if you're servicing the healthcare community, there is no way that you cannot be a part of this movement.
Although we're a large national chain, we feel like each of our stores are neighborhood pharmacies, and we support the people in those neighborhoods just like they support us.
At the Elton John AIDS Foundation, our work is definitely cut out for us. Because treatment is prevention, we must insist upon the full funding of AIDS drug assistance programs. Because silence equals death, we must continue to speak out for the health and human rights of vulnerable people. And because we are all greater than AIDS, together we can achieve a world without AIDS.
You know me, I've never been one to stop and sit and rest on my own laurels. There's so much more to be done. And now I have something else other than my career to focus on with the foundation. So things are pretty damn good.